The list of things pregnant women can and cannot eat is enough to make anyone's head spin, which is the last thing you want if you're also dealing with morning sickness. So here with a new app to help moms-to-be sort it all out is Dr. Rydfors, founder of the Pregnancy Companion app. Hi, Doctor. Thanks so much for joining us.
Yeah, glad to be here, Tanya.
So, Doctor, tell us, what are some of the things this app helps pregnant women track?
It gives them up-to-date aspect of what's happening during their pregnancy, both with their baby and themselves. It helps them track how much water they're drinking. It has an extensive list of questions and answers, over 100 questions and answers that they can go to. It tells them which drugs are safe to take in pregnancy. It tracks their weight. Pretty much it does everything that you would want to use.
Sounds very useful. Now let's get to the food. Let's start with caffeine. What's the consensus here? I must confess, working as a journalist with crazy schedules, while I was pregnant, I drank a lot of it.
Yeah, that's a good one. There's a lot of misinformation about caffeine. You know, the older studies did show that it might increase the risk of miscarriages and early labor. But the more recent, larger studies have shown that caffeine in moderation is actually quite safe.
All right, good.
You can drink up to 200 milligrams per day, which is 2 cups of coffee, 4 espressos, 4 cups of tea, 4 Cokes.
I'm very glad to hear that. Now, doctor, what about just 1 glass of wine every now and then?
The real answer, we don't know. There's no studies that have shown that it causes a problem. So what I tell my patients is half a glass of wine on special occasions with food is probably very low risk.
Okay. So, doctor, there are a lot of sushi lovers out there, myself included. So what's the lowdown on mercury levels in fish and bacteria in sushi?
Sushi is actually safe in most cases. It turns out that in America, all fish that's used for sushi is flash frozen. So all the bacteria, all the parasites have been killed off. There are 2 things you should think about, however. One of them is that you should stay away from sushi that contains fish with large amounts of mercury, such as tuna, shark, swordfish, and mackerel. And then finally, all the other fish containing sushi, do remember that even if they don't have that much mercury in them, you should not have more than 2 to 3 servings per week.
All right. Thank you, Dr. Rydfors, for all that important information.
Thank you.